between 25 and 45. They have a 17% positive rate. Now remember, in order to get tested, you have to have symptoms. So this gives you an idea of the number of people who have symptoms that are not infected with coronavirus. Another nearly 500,000 people between 45 and 65, their positivity rate is 21%. Another nearly 200,000 between 65 and 85, 22% positive, and a small group of about 30+ thousand individuals over 85, and they have a 24% positivity rate. And so this gives you an idea of we're testing throughout all age categories. I see a lot of men in the audience today. I just want to remind them about the importance of health care. Of the male-female ratio, 56% of the people who are tested are female, 16% positive, 44% male, 23% positive. So again, it gives you an idea about how men often don't present in the healthcare delivery system until they have greater symptomatology. This is to all of our men out there, no matter what age group. If you have symptoms, you should be tested and make sure that you are tested. We appreciate you engaging in that, and also really recognizing the issues about comorbidities and making sure that we're addressing those. I had a series of great calls with about 17 states that are in our more rural areas, specifically around our indigenous people and tribal nations. It was a very reassuring call, and we are testing across the country. We do have about 63% of states that have less than 10% positive despite significant testing. And within the indigenous peoples and tribal nations, they're seeing the same thing that we're seeing across the nation, increased issues among those with comorbidities and those of elderly, but also issues in nursing homes. And so they are testing, many of these states are still capable of doing full contact tracing. And so they've been doing contact tracing from nursing home outbreaks and other outbreaks. It really gives us a clear impression of no matter what we do in the future, we need to really ensure that nursing homes have sentinel surveillance. And what do I mean by that? That we're actively testing in nursing homes, both the residents and the workers at all times. That is where, and that's how we saw this at the beginning. That's what we saw in Washington State. And that's what we're seeing in many of the states that have very low case attack rates. The other thing that I want to leave you with, we certainly know how desperate and difficult the situation has been in New York over the last few weeks. And we've been telling and talking about how this would be the week that would be most difficult because of the large proportion of cases that are coming from the New York metro area. What's been encouraging to us, those early states outside of Washington and California, which still have extraordinarily low attack rates because of their level of mitigation, all of the new areas that are having new increasing cases, we talked about them yesterday, Washington and Baltimore and the Philadelphia metro area. That includes Camden, Wilmington, and the counties around Philadelphia. We're seeing that the case numbers, what we'll get to as far as attack rates, we talked about 1 in 7 in 1,000 in New York that are being measured. These are coming in, even with their progress up their curve, in the 1 to 2 per 1,000 range, showing that when you start mitigation early, it has a very different impact. All of this data is coming together, the testing rates, the seropositivity, the age groups, who really needs hospitalization, ICU, the innovative pieces coming from, we heard a great report from Louisiana this morning on the phone call where they talked about a minimum now of 40% of people coming off of ventilators alive and leaving the hospital. This is very encouraging to us. Really shows amazing progress clinically at each of these hospitals and the real lessons what we're learning and sharing across hospitals. But really shows us that the original outbreaks were very large, but the newer ones that we talk about in Washington and Philadelphia and Baltimore, it looks like their attack rates and the attack rates in Denver and some of these other states that we have been talking about are much lower. than New York and New Jersey. And this gives us hope about really understanding how to integrate this information together, not dealing with a model, but the real life cases that are occurring, and understanding how to move forward together to really have a different future. So thank you very much.
Thank you very much, Mr. Vice President. So just reflecting about what we've been doing over the last few days, remember last weekend when we made the forecast that this would really be a bad week? As I mentioned yesterday and the day before, it is, in the sense of deaths, a bad week. In fact, every day there seems to be a record of number of deaths compared to the day before. In fact, New York today had, again, another record of, I think the city itself was about 820 plus deaths. But what we were predicting with the increase and the real adherence to the physical separation, the guidelines that the Vice President talks about, the physical separation, at the same time as we're seeing the increase in deaths, we're seeing rather dramatic decrease in the need for hospitalizations. Like I think yesterday was something like 200 new hospitalizations, and it's been as high as 1,400 at any given time. So that is going in the right direction. I say that, and I always remind myself when I say that, that means that what we are doing is working, and therefore we need to continue to do it. I know I sound like a broken record. That's good. I want to sound like a broken record. Let's just keep doing it. I get questions a lot, Dr. Birx and I, about these numbers, the projections that you went with from 100,000, 200,000, now down to 60,000. That's a sign that when, as I keep saying, when you take the data you have and you reinsert it into the model modifies. Data is real, model is hypothesis, okay? So that's what you have to do, and that's what I think we're seeing. The other thing that's some just broad, general good news from the standpoint of a scientific standpoint, that there are a lot of candidate potential therapeutics that are going into clinical trials now that we're sponsoring at the NIH, the kinds of clinical trials that will give us the answer. Are they safe? Are they effective? And just what is the capability of using them under what circumstances, as prophylaxis, as treatment, in early disease, in late disease. So as the time goes by and we have the public health measures to try and contain this, we're doing an awful lot from a scientific standpoint so that when we do get to next year, next fall, next winter, hopefully we'll have something that we can offer in addition to the very important public health measures. So I'll be happy to answer questions later.
Mr. Secretary.